Make summer more delicious with Whole Foods Market, where there's something for every adventure. Get ready for road trips with wallet-happy snacks, sparkling waters, and sports drinks from 365 by Whole Foods Market. Taking a staycation? Make it count with wild-caught fresh sockeye salmon, beef kebabs, and sirloin steaks for the grill, plus sweet and juicy summer fruit like sugar-kissed melons and organic cantaloupes. Don't forget fruit-filled pies for dessert. Summer your way with Whole Foods Market.
It's no secret that opioid-related deaths have been on the rise the last few years. The CDC reports that almost 1 million people have died from an overdose since 1999. But as many of us know, a drug addiction doesn't just affect the user. Between 2017 and 2020, drug overdose deaths among pregnant and postpartum women more than doubled, according to a 2022 research letter published in JAMA. As more and more women develop an opioid use disorder, the number of affected babies continues to grow as well.
The incidence of neonatal abstinence syndrome or neonatal opioid withdrawal syndrome has grown about 7-fold over the last 2 decades. And today, about 1 infant is born every 15 minutes nationwide diagnosed with the syndrome. So the rise that we've seen in opioid use disorder diagnoses really parallels what we've seen in diagnosis of opioid withdrawal.
That's Dr. Stephen Patrick, a neonatologist and director of the Vanderbilt Center for Child Health Policy at Vanderbilt University. He says that if there's chronic opioid use during a pregnancy, neonatal opioid withdrawal syndrome, or NOWS, will occur just after a baby is born. Since the baby was coming in constant contact with the drugs while in the womb, the sudden absence after birth will spur the withdrawal symptoms.
The syndrome itself is characterized by, and what it looks like, are a baby who is irritable, jittery, has increased muscle tone. They can have difficulty feeding, can have rapid weight loss too. That's what we see. And one of the ways I oftentimes describe it is it's like a colicky baby times 5. It's usually a pretty fussy baby that we see when they have drug withdrawal.
If you touch the baby startles extremely easily. That may be as extreme as having seizures. These babies are not consolable. They cry a lot and they don't respond to typical soothing methods. These babies don't feed well. They're not satisfied. They also will have GI disturbances. So they're very hard to take care of.
That's Dr. Diana Bianchi, the director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development at the NIH. She says the severity of the syndrome, or even if the baby develops it at all, depends on a few conditions.
Some of it depends on the timing when the exposure occurs during pregnancy, and of course, the amount and the type of the opioids.
A mother's drug use later in pregnancy, closer to the delivery, creates a greater risk of the baby developing NOWS. And though it's been discussed since the 1970s, there hasn't been a standard approach to treating the condition. A 2021 study published in the journal Pediatrics reviewed 30 hospitals and saw that each one had a different treatment plan for babies with the syndrome.
In one hospital, they might be using methadone. In another hospital, they might be using phenobarbital. It just varied significantly, although many of them were using something called the Finnegan Neonatal Abstinence Scoring Tool, or FNAST. And that's a tool that has been used for over 50 years to score the infant's symptoms and to use the score, a number, to decide whether the baby needs medical treatment or not.
The issue with the FNAS score is that it's very subjective and, according to Bianchi, usually results in over-medicating newborns with opioids.
Well, that score is from the 1970s. It was mainly on term infants, and it was purely a heroin-exposed population, and it's never been validated. And so there's been some work recently to really improve the way we deliver care, how we score infants. That's where we've seen the science really start to advance beyond where it was before.
Make summer more delicious with Whole Foods Market, where there's something for every adventure. Get ready for road trips with wallet-happy snacks, sparkling waters, and sports drinks from 365 by Whole Foods Market. Taking a staycation? Make it count with wild-caught fresh sockeye salmon, beef kebabs, and sirloin steaks for the grill, plus sweet and juicy summer fruit like sugar-kissed melons and organic cantaloupes. Don't forget fruit-filled pies for dessert. Summer your way with Whole Foods Market.
This episode is brought to you by Sol de Janeiro. At Sol de Janeiro, touch isn't just for screens. Physical connection is so essential to how we communicate. It's infused in everything we offer. Scents so irresistible, PDA is guaranteed. Textures are so luscious, skin is huggable. Get into a Sol de Janeiro state of mind. Receive 10% off on your first order on soldejaneiro.com, plus free shipping with the code SOLDEJaneiro10.
Patrick says that many states have taken cues from emerging research over the last 10 years to greatly improve their hospitals' care plans. Part of this new research includes a recently published paper in the New England Journal of Medicine. It describes a new method of care called Eat, Sleep, and Console,
where the babies consoled, meaning there was a lot of skin-to-skin contact. They were swaddled. They were rocked in a rocking chair. They were held a lot. They were fed whenever they needed to be fed. They were allowed to sleep. They weren't awakened to feed. And importantly, they were in a darker, quieter environment so that they weren't set off by bright lights or by bells or alarms in the newborn intensive care unit.
This study shows that on average, babies being treated with the Eat, Sleep, and Console method were ready to be discharged up to a week before those treated with a different approach at the same hospital.
In addition, the babies that were treated with Eat, Sleep, and Console had a 60% less use of medications. So less exposure to opioids and being ready for discharge a week earlier. That's an amazing success rate.
Patrick says this new approach is much more straightforward than anything they've had in the past.
In years past, we've had this really convoluted system where we score infants on whether or not they have projectile vomiting. It's really complicated, and you have to do that every 3 hours. What Eat, Sleep, Console says is, can the baby eat? Can they sleep? Can we console them? They're probably okay. It's basically treating a baby like a baby. And so we've seen success with that. And the recent study in New England Journal highlighted a lot of those successes.
The babies in the new study were followed up to 3 months after birth. The researchers plan to continue checking up on them until the 2-year mark to make sure there are no negative side effects from leaving the hospital so much sooner than other children with NOWs. It's ultimately up to the American Academy of Pediatrics to make the Eat, Sleep, Console method a standard recommendation for all nurseries. But Patrick believes that most hospitals around the country will get on board. And while this is a great step in treating neonatal opioid withdrawal syndrome, Patrick says we also need to focus on the root cause of the condition, which is the mother's opioid use disorder.
So let's say that moms have an opioid use disorder. If they abruptly stop using opioids, that can result in pregnancy loss. But treatment with medications for opioid use disorder is safe and effective, and by far is associated with superior outcomes for both mom and baby. So medications like buprenorphine or methadone make it more likely the baby is going to be born at term, and they greatly reduce mom's risk of having an overdose. One of the things to know is that there's oftentimes this focus on babies who have opioid withdrawal. And sometimes we forget about the bigger population of infants, and those are infants that are exposed to opioids that may not develop drug withdrawal. So in our hospital system, only about 20% of babies that are exposed to opioids get a diagnosis of drug withdrawal.
Some babies never receive a diagnosis because they're born extremely preterm, which Patrick says results in them not being mature enough to have drug withdrawal. And while it's great that these babies don't have to suffer in that way, being born prematurely comes with a whole other host of problems that can have lifelong effects.
So one of the things we're trying to do by getting moms into treatment is to prevent that very preterm infant for a bigger term infant. So if we're looking holistically, it's not just about preventing opioid withdrawal in newborns, because opioid withdrawal can happen from treatment of moms. What we're trying to do is prevent that preterm birth, and we're trying to keep mom from having an overdose death.
Patrick believes that in order to stop the rising trend of neonatal opioid withdrawal syndrome, we have to think about public health as a whole. Instead of only focusing on the mothers and children, we need to look at how we approach drug addiction in our country and how to prevent opioid use before pregnancy.
And it begins with making sure that we have good interconception and preconception health. In some ways, that leads to things like Medicaid expansion in states, that we have healthy moms before they become pregnancy. and then focusing on optimizing health in pregnancy, connecting to treatment where people don't have treatments. Those are the best steps that we have now to fix this problem. And I would say that treatment is exceptionally difficult to get. So our team has done some work around this. How hard is it to get into treatment if you're pregnant? We know that people that are pregnant are about 17 percentage points less likely to be accepted for treatment than identical non-pregnant women.
Which just worsens an already dire issue. Getting a handle on America's opioid addiction problem is a daunting task that's been at the heart of social debates since the first wave of prescription drug abuse in the 1990s. However, Patrick says the time and effort that's needed to make a change is worth the lives that will be saved.
Today, nationwide, we're seeing record levels of overdose deaths among pregnant women. Infants are entering foster care at a higher rate than any other population, most due to parental substance use. So we have a globally broken system, and it's not going to take one. We can't fix it with one thing. We have to take a holistic view to really fix this problem as a nation.
You can find more information about Dr. Stephen Patrick, Dr. Diana Bianchi, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal.
You have to be honest about your own abilities, your own failings, your own inabilities. There's no morally easy answer there as to what you ought or ought not do.
Diving into the ethical dilemmas of medicine.
Then a new mind-bending approach to treating depression.
The fact that we saw remission in 37% of patients at week 3 after just a single administration is something that's really encouraging to us.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I will just go sit at a bar and talk to the bartenders because they know so many of the neighborhood secrets.
You'll never know what you're missing if you don't go out and ask. Then,
when you have to explain to a guest, oh, it's prosciutto, they look at it and say, oh, it's ham. Not everyone understands that this pig ate acorns for 8 months and that it was dry cured and air dried.
The lengths some fine dining chefs go to. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Pulling up to Mickey D's just for drinks? Oh yeah, that's me. Nothing extra, just perfection and a straw. Coming in hot for the coldest cups on the block. Because there are drinks. Then there are drinks from McDonald's.
Get a creamy Oreo frappe or McCafe smoothie for less with 20% off any purchase of $10 or more. Only on the app. Limited time only at participating McDonald's. Valid one time per day. Visit McDonald's app for details.
Ba-da-ba-ba-ba.